HPV-related cancers have become much more prevalent. Traditionally, we think about alcohol and tobacco as being the risk factors for head and neck cancer and lung cancer. In the head and neck, we're now seeing an increase in these virally mediated tumors of the oropharynx. And so the oropharynx consists of the tonsils and the back of the tongue, an area of the tongue that's difficult to see. We are seeing more and more of these tumors, as are multiple institutions, and now have many clinical trials available for these patients, including surgical trials and non-surgical trials. And so we have the ability to offer minimally invasive surgical techniques using robotic surgery or working through the mouth as opposed to making large neck incisions for some of these types of tumors. This offers patients an opportunity to get through treatment with less difficulty swallowing, less long-term complications from whatever the treatment may be. So we're starting to think out 10 years instead of 5 years for many of these patients because we expect that they're going to do very well, and we want to minimize the treatment-related side effects that they may have years down the road. One of the advantages I think that we feel very fortunate in is that we have a excellent speech and swallowing team. So each of us clinicians has a speech and swallowing therapist available to us every time we have a clinic. And this allows us to call upon them if somebody's having a specific need as it relates to problems with swallowing or voice, and be seen that very day for at least a conversation and then an arrangement for perhaps a more formal appointment down the road. So from the standpoint of quality of life, oftentimes the speech and swallowing is one of the most important components, and that's particularly important for the HPV-related tumors, where we're again thinking much longer term down the road because we expect these patients are going to achieve cure, and we want to figure out a way to get them to that place and still be able to function with a very high degree of quality of life.